What are the treatment options for prostate calcification? Imagine discovering tiny calcium deposits inside your prostate during an imaging scan. That's what prostate calcification is, small calcium buildups that often show up by chance. The good news is that most of the time, these calcifications don't cause symptoms and don't need treatment. But when they do lead to discomfort or other issues, there are several options to consider. If the calcifications are linked to an infection, especially chronic prostatitis, antibiotics are usually the first step. These medicines help clear out bacteria that might be causing inflammation and discomfort. The length of antibiotic treatment can vary from a few weeks to longer, depending on how your body responds and the results of lab tests. Along with antibiotics, anti-inflammatory drugs can help reduce pain and swelling in the pelvic area. These can be prescribed by your doctor or sometimes taken over the counter under medical guidance. Medications called alpha blockers, like tamsulosin, are often used to ease urinary symptoms caused by prostate swelling or inflammation. They work by relaxing the muscles around the bladder, neck, and prostate, making it easier to urinate. Some patients also find plant-based supplements, such as quercetin, helpful as an adjunct therapy to reduce inflammation, but these are not primary treatments and should be discussed with your doctor. Lifestyle changes can also make a difference. Drinking plenty of water, reducing caffeine and alcohol intake, doing pelvic floor exercises, and taking warm sitz baths can help manage symptoms and improve comfort. These approaches are simple, low-cost, and often effective for mild cases. In some situations, especially when calcifications are larger or causing persistent symptoms, minimally invasive procedures might be considered. Laser therapy or microwave thermotherapy use energy to break down or shrink calcified deposits, often with quicker recovery times than traditional surgery. Shock-wave lithotripsy, a technique borrowed from kidney stone treatment, can sometimes be used to fragment larger calcifications in the prostate. When symptoms are severe or other treatments haven't helped, surgery may be necessary. The most common surgical procedure is transurethral resection of the prostate, which involves removing part of the prostate tissue, including calcified areas, to relieving urinary obstruction. In certain cases, transurethral incision of the bladder neck might be performed to improve urine flow. For many men with prostate calcifications that aren't causing problems, active monitoring is all that's needed. Regular checkups with your healthcare provider can ensure the calcifications aren't growing or causing new issues. It's important to remember that, if underlying causes like infection or inflammation aren't addressed, calcifications may recur. Prostate calcifications can sometimes coexist with prostate cancer, which makes careful evaluation essential. Calcifications can interfere with imaging techniques like ultrasound or radiation therapy, so planning treatment for prostate cancer requires detailed assessment by specialists. Ultimately, treatment depends on your symptoms, overall health, and whether the calcifications are causing problems. Always consult a healthcare professional to develop a personalized plan. Most importantly, managing prostate calcification involves addressing any underlying issues, relieving symptoms, and avoiding unnecessary interventions. With proper care, many men find relief and maintain good prostate health.